All right, you 12s, as promised, for your practice test, August, or revision questions, here's a review of all the answers and some discussion points that you can consider coming up to Friday's test. So the first question had a look at, I guess, this graph which shows an athlete heart rate before training and an athlete's heart rate after training. You can see here the heart rate tends to go up in sections, and it's not quite as consistent where the heart rate from the second athlete is quite a consistent increase until they get to their max heart rate at the top, and it tends to take a bit longer. So you can also see with the resting heart rate, the after training is considerably lower. So let's look at the first question. That's just analysing the question before you even look at the first part. So it's just one reason why the level of normal resting heart rate in the test after training differs from the level of normal resting heart rate in the test before training. So we can see over here the higher stroke volume means that the heart doesn't need to work as hard at rest, so we tend to have less beats per minute. We maintain the same cardiac output because at rest we still need the same amount of oxygenated blood to go around our body to function, but if we have a lower heart rate, it means that we have a higher stroke volume. So I've written there, more blood pumped out per beat, meaning the heart doesn't have to beat as many times per minute to pump the required amount of blood at rest for normal body function. Okay, let's move on to the next question. So training changes the response of the heart rate to exercise. With reference to the diagram on the page opposite, state 3 effects that training has on the athlete's heart rate. So again, looking back at that diagram, I would say that we would have a lower resting heart rate. We might have a more steady incline to our higher heart rates. And what else have I written here? More steady incline, higher. The heart rate takes longer to increase throughout the exercise. So again, our oxygen delivery is more efficient due to our larger cardiac output, and we're able to plateau at our maximum heart rate. The next question says, when measured in exercise about 4 of the test before training and test after training, the athlete's cardiac output is the same. State 2 reasons for this, given the athlete's heart rate is different. So we can see here about 4, the athlete's heart rate is different. Now what the question is saying is if the athlete's cardiac output is the same. So you'd say the reason 1, I said, we have a higher stroke volume for the athlete that after training, meaning the athlete's heart rate does not need to be as high. And the reason 2 is the first athlete that hadn't been training, stroke volume is lower, meaning the heart rate needs to be higher. So they're both around that cardiac output question. Explain why the performance of the athlete who failed to hydrate would be restricted. So it's good to point out that being hydrate affects the blood plasma volume. So blood plasma volume, of course, aids the oxygen to be able to get from the hemoglobin to the myoglobin as part of that diffusion process. So if the plasma is reduced through lack of hydration, this means the pathway for the oxygen to the mitochondria is restricted, meaning again our oxygen delivery is affected, bringing that more reliance on the lactic acid system, becoming fatigued. If we're hydrated and working at a high aerobic intensity, we can do that without fatigue. If we're suffering dehydration, our body is unable to deliver that oxygen because of the low plasma levels. Okay, so again, new graph here, referring to the graph of the aerobic fitness text on a treadmill, showing chronic change to a player's accumulation of blood lactic acid as a result of this training program. So let's look here. We've got blood lactic acid levels up this axis, and we've got our treadmill speed. So that's an interesting point, looking at going up in 5 kilometers per hour. So again, our training before program and after program, we can see here our before training program has a significant spike earlier on in the treadmill speed. So about 11 there compared to at about 15 there. So explain one physiological change that contributes to the change of the accumulation of blood lactate, as shown in the graph above. So I've said a more efficient oxygen delivery because of the following adaptations that we've talked about, which allows for that oxygen delivery. So increased blood volume, increased hemoglobin, myoglobin, increased capillarization, increased mitochondria. And what this does is it allows athletes to perform at a higher aerobic intensity, less reliance on anaerobic systems, which cause fatigue. So the next question says, using one example, explain the effect that this change would have on the player's performance in the game. So again, I've said that in the first question about being able to perform at the higher aerobic intensity. But what I'm going to do is I'm going to pull bits off the graph. So the athletes would be able to run approximately 2 to 3 kilometers per hour faster over an extended period before they would feel any extreme effects of OBLA. So I can say, OBLA starts for that trained athlete at about 15 kilometers per hour compared to that treadmill speed of the untrained athlete, which is sort of 11 or 12. And I've written here, graph shows that athlete A reaches OBLA about 11 kilometers per hour, where B is at about 14 kilometers per hour. So over an hour period, one athlete would be able to run over 3 kilometers per hour further. So again, my analysis has been supported by getting data off the graph. All right, next question, another good graph. So let's look at that. So referring to the following graph, which shows a redistribution of blood flow to major organs during body exercise. So we know as an acute response that when we start exercising, the blood comes from our major organs, which at rest is all it really needs to go to the working muscles that are isolated in those movements. So we can see here line A shows the blood flow increasing, and line B shows the blood flow decreasing. All right, from cardiac output. So which line shows the blood flow to the skeletal muscles? So as we start to exercise, more blood flow would come to the skeletal muscles. So I've said line A. Which is all you need. You don't need to justify it. You just need to say line A or B, and you get the mark for it. B, state one physiological reason why the redistribution of blood flow occurs during exercise. So muscles need oxygen. If they get oxygen, they can perform aerobic respiration for 2 marks. So work aerobically with minimal lactic acid buildup. No oxygen, lactic acid buildup, restricted performance. So again, one physiological reason. We need oxygen for aerobic respiration. Okay. Describe 2 acute responses to exercise that enable the redistribution of blood flow to occur, as shown in the graph above. So acute responses which would allow this, so increased heart rate, more oxygenated blood around the body, so being able to get redistributed blood to our muscles, our heart rate needs to increase. If we need more oxygen in that blood, our breathing rate needs to increase. You could also talk about increased ventilation, increased stroke volume, all those sorts of things, increased cardiac output, all those sorts of things that are going to get oxygenated blood to working muscles. All right, D. Identify one chronic adaptation that may be associated with volume of blood if an athlete undergoes extended training. So again, identify. It doesn't ask you to explain or annotate or develop or whatever. Just identify. So I've just said an increased hemoglobin, blood volume, red blood cell count, increased plasma, anything like that. Okay, easy mark. Explain this, and now you've got to be able to explain it. So it's important you pick one that you can explain. So explain the effect of this chronic adaptation on performance. So I've said all these things will allow for more blood to be distributed to the muscles. More oxygenated blood at the mitochondria equals more aerobic respiration. So greater aerobic respiration means the athlete can work at a higher aerobic intensity, which would result in a runner maybe running 2 to 3 kilometers per hour faster, which will result in an increase in his overall performance. So because they wrote performance, I've talked about how they can increase their performance with specific numbers. All right, remembering that if we want to make sure we get those analysis marks, we're talking about numbers. All right, next question. Refer to the following graph, which shows the relationship between heart rate, running speed, and accumulation of lactic acid in the blood for untrained 25-year-old athlete during running tests conducted with an increased intensity to the point of exhaustion. So we could talk about this probably being the beak test. Okay, so let's look at line A. Shows somebody who gets a quick spike in blood lactate acid or blood lactate, and line B shows a steady state there and a gradual increase in their blood lactate. Using evidence from the graph, explain which line, A or B, represents the heart rate of an untrained athlete. So I'd say line A, 1 mark, getting that right. Represent an untrained athlete, we can see that line A experiences a sudden spike in blood lactate levels from about 2 meters per second, where line B doesn't experience any significant spike until 3.5 meters per second. Again, pulling data off the table. Explain why line A levels out at the end as the end of the test approaches. So I'll say line 8 levels out near the end because the athlete potentially has reached their maximum heart rate. How do I pick that? Question states the athlete's 25 years old. 220 minus 25 equals 195 BPM. Graph indicates that the heart rate gets to this point then levels out. It could also be that athlete's actually finished. Alright, so they didn't get past that point. Alright, so that's another way, but 2 marks, that's enough. Alrighty, let's have a look. Identify and explain the dominant energy system used by the untrained athlete while running at 2.5 meters per second. Let's go back. What are they doing at 2.5 meters per second? Alright. So I'd say they're experiencing obla. So, what have I written here? 2.5 meters per second, the dominant energy system is the lactic acid system. 2.5 meters per second, we witness a spike in blood lactate levels. You could probably even put that on there. So going from level of about 4, we've increased in that half a meter per second from 2 to 6. All right, it could have been, it's up to you. It's 3 marks. Spike blood lactate byproduct work in the lactic acid system is lactic acid. Therefore, we can validate the reasoning for this spike. All right, probably a good thing to put in the change in that levels, the numbers. All right, D. Use evidence from the graphs opposite. Explain why the untrained athlete would need to maintain a particular running speed for most of the 5 kilometre road race in order to maximise performance. So, I've said here, we can see anything further than 2, we're experiencing a spike in the lactic acid and the blood lactate. So I've said an untrained athlete would need to work at 2 meters per second or below for most of the 5 kilometre race. If she worked at a higher intensity, she would experience a severe obla, which would cause fatigue, not allowing her to complete the 5 kilometres effectively or efficiently. So she needs to work below that because we can see anything above that is experiencing obla. So if we're experiencing lactic acid accumulation, then we're going to be fatigued. All right, E. State the physiological term you describe point Z on the graph. So I say point Z would be maybe where they're working at a steady state or just below the lactic threshold. After this point, we could see a spike in the blood lactate levels. So the athlete completed an identical running test after 3 months of endurance training. Explain how the position of point Z in the graph would most likely have moved at this point of training. Alright, so let's look at point Z. It's point Z, where that's starting to... Alright, if they're training for longer, it could move over to here. Alright, so you could see a greater steady state into a faster speed and then an increase, something to those extent. I've actually missed putting that in the answer, so I apologise for that. Alright, recovery after completing this test involves post-oxygen consumption, or EPOC. One phase of this is our lactic acid debt. Alright, so describe one purpose of our lactic acid debt. So one, you have to know what it is, and one purpose of it. So replenishes PC stores, therefore when we have a short burst of high intensity effort is required, the athletes can use the PC stores that we have replenished, and you could even write in there not get the great level of blood lactate that would come with working in the lactic acid system. Alright, well hopefully that has helped. There's about 14 minutes worth. Please use the answers to go back through and aid you when you're revising for that test. All the best, and I'll see you on Friday.